I'm Leisa Hirtz. I'm the founder and CEO of Women's Global Health Innovations and the developer of the Be Free Cup. Women's Global Health Innovations was developed back over a decade ago, very specifically to address the lack of innovation in period products, looking at the issues of period poverty and how we might be able to address that in a more environmentally sustainable, healthier, more accessible way, looking at some of the challenges that adolescent girls and young women living in low and middle income countries have in accessing commercially available hygienic period products that would give them the self-empowerment to stay in school, stay healthy, engage in society. So we developed the Be Free Cup. We went into research and we were looking at silicone. How can we create a silicone that was super hydrophobic? And what that meant was physically antibacterial, where a biofilm or bacteria wouldn't stick to it, so they wouldn't have to boil it like all other menstrual cups. So we had proof of concept quite early on, and it worked. We redesigned it so it was easier to use, really soft, comfortable, and tested it for aging. One Be Free Cup can last for 10 plus years. We trained 23 women and 2 men to be comprehensive menstrual health and hygiene trainers within the Ouganda district in northern Uganda. The overall thinking was bring people into the market, especially women, so that they have this comprehensive training and capacity to deliver the very vital education in regard to menstruation, reproduction, the full menstrual cycle. I've learned so much in regard to how much the fathers or the men within the community, who are typically the person that oversees the family budget, typically the person that the daughter or the wife goes to ask to request money to buy pads every month. How the interactions between those within that community, they have this inter-dialogue. It was the fathers, and the men and boyfriends as well, that were looking at this as a really brilliant solution to the month-to-month requesting money. And the other aspect was the women regarding having a livelihood in selling, and it was successful, that the husband said, my wife is now helping with the household budget. There's always so much room for further innovation, especially in women's health. We have another product which is called the Be Free Duo. And the idea didn't come from me. It was just listening. And those that have problem, those that are living with the challenge, there were girls that asked, could it be used as a contraceptive? And being a product developer, I was just like, oh, what a brilliant question. It can be done. So, we developed the Be Free Duo. And this is just the prototype, one of the first prototypes, that it's a menstrual cup as well as a cervical cap. So it works as a barrier contraceptive. When you look at a girl crying and saying, this has changed my life, it fuels your determination. One life, one Be Free Cup at a time, one girl at a time. Even just the education has such an impact.